30 years old and very bad under eye bags and extremely wrinkled skin. What is the best procedure to fix this? I am 30 years old and genetics have blessed me with extremely thin eye skin and under eye bags, aging me beyond my years. I am most concerned with removing the excess skin wrinkles under my eyes that get much worse when I smile, and also the bags. Would a fat removal or transfer help? I find it hard to smile when talking to someone face to face, knowing they will see how terrible my wrinkles look. My skin elasticity is pretty bad. What can be done?
Thank you for your question. You're 30 years old and genetics has, as you wrote, blessed you with puffiness and wrinkled skin under the eyes, and which appears to age you well beyond your years. Well, certainly this is reflective of my descriptions in my book, The Fine Art of Looking Younger, and understanding very well that puffiness and wrinkled skin under the eyes certainly does make you look older than your age. So what are your options? Well, there are certainly a few options, but understanding first what each anatomical issue is and then developing a strategy is very important. Now, from when you meet with different doctors, you will get different opinions. So I'm simply going to share with you what is typically what I do in my practice. And if other doctors disagree, I'm not going to necessarily say they're wrong, but everyone's got a personal style, and when you do your research, you'll figure out what resonates best for you. So when people come to me and complain of puffiness, I first teach them that the puffiness under the eyes that's always there regardless of allergies, sinuses, or getting enough sleep is most likely something called lower eyelid fat prolapse. Now you are right on target because genetics is such an important factor. And within the same family I have operated on 3 generations, and so certainly it does run in families. So this fat prolapse is herniated fat that pushes forward, and regardless of the amount of sleep or any other topical treatment, it won't change. Now, on younger people like yourself, I generally do a procedure called a transconjunctival blepharoplasty. Now, transconjunctival blepharoplasty means what I do is go from the inside of the eyelid and I address the fat pockets. Now, there's a combination of procedures such as resecting and removal, as well as repositioning that we perform based on the individual anatomic situation. And what's great about this approach is there's no external incision, there's no compromise to the anatomy of the support system of the lower eyelid. A very popular approach to lower eyelid surgery done mostly by general plastic surgeons is an external or transcutaneous blepharoplasty, and someone like yourself who is complaining of wrinkled skin may be perceived or diagnosed as having too much skin. And in my experience, that is generally not the case in someone as young as you. And unfortunately, very young people have had bad experiences where skin was removed and they end up getting a widened scar on the outside and their eyelids get pulled down in a condition called eyelid lid retraction or lower eyelid retraction. So you have to be mindful and be very careful about making a decision about having the procedure done from the outside. You see, I try to teach my patients there's a difference between skin excess or redundancy and skin quality. The skin quality is the issue for you. It's thin. It's genetically thin. Certainly other environmental factors such as smoking and sun exposure can further age the skin. Now, in our practice, we have a couple of different approaches to help skin quality. And it's not only a one-time procedure. Lower eyelid puffiness can be a one-time procedure, but skin quality generally requires some type of ongoing care because skin is living and changing. But what we will typically do with the lower eyelid blepharoplasty is we will do something called the injection of platelet-rich plasma. Now, platelet-rich plasma is the serum in your blood that is, after being spun down, the serum above the red blood cells is separated, and it's rich in platelets. Platelets are the cells responsible for healing when you get a cut. So what we've had very good results with is injecting platelet-rich plasma under the skin and essentially stimulating the collagen remodeling that helps improve the quality of the skin. And it also has something called vascular endothelial growth factors, which stimulate blood flow and blood supply. And that makes platelet-rich plasma very unique compared to any other type of filler. So we do that, and in some people, depending on the skin type, we'll do fractional CO2 laser, or we'll do radiofrequency, such as Pelave, to help maybe tighten the skin. Again, we do this on a very case-by-case basis. On top of that, we also will do a very steady enhancement using topical skincare products. We happen to have our own skincare line, and we have a product called Eye Rescue, as well as different strengths of retinols. And when I designed these products, I wanted to be sure that the products would have good moisturizing capability as well as good cell turnover. And so in some people, we'll actually also use topical vitamin C, and we'll just customize these topical products. Unfortunately, topical products that are sold over the counter have limited amount in their active ingredients, and the FDA and FTC actually limits how much of those active ingredients can be on a topical product that's over the counter. Our products, which are dispensed through our office, are dispensed through supervision. So we've had the luxury of being able to make these active ingredients a little bit stronger. And so this is a combination approach. You know, that's basically the take-home message, is that improving skin quality is not usually a one-time thing, but a lot of difference can be made. And sometimes a lot of times it doesn't have to be so complicated or so involved. Very often with the platelet-rich plasma and a topical treatment such as fractional CO2 laser, we get really, really nice results. And we just tell our patients, wear sunblock, drink a lot of water, avoid toxins such as cigarette smoke. So I think that the next step for you is to now meet with qualified, experienced cosmetic surgeons who perform a lot of eyelid surgery and who are able to handle any of the challenges and are not limited by one or two particular specific methods. And you'll get the feel based on looking at their work, their results, their portfolios, on whether, and as well as the dialogue that you have with the doctor in terms of them resonating with you and you being able to feel comfortable and confident in their ability to do your work. So I hope that was helpful, and thank you for your question.